Hello everyone, welcome to my channel Study Nursing by Sense Goals. Today in this video we are going to discuss about nursing diagnosis or nursing care plan for asthma. So in this particular video we discuss about 7 to 8 different nursing problems one can have in respiratory disease condition named asthma. Before we go ahead, I would also want to recommend a couple of other related videos which could be useful for you to work as a nurse. So they are short notes on the diseases, some drug studies, sample nursing care plans, and finally introduction to how to prepare a detailed nursing care plan. It would be particularly useful if you're at the beginning of the career. So without much ado, we will go to the first nursing diagnosis. As you very well know, airway, breathing, circulation, A, B, C are the essentials for life. It is with common sense imperative that you include anything related to airway clearance or anything related to breathing as a primary problem in any of your patients. So obviously, when you have asthmatic attack, you have an impaired airway clearance because of the disease conditions that because of the disease condition. And these are the three different nursing diagnoses I have put across. It's not always necessary that your patient can have excessive secretion in case of asthma. Sometimes it could be really dry, breathing pattern. Sometimes it could be the continuous wheezing which your patient can have. So depending on what your patients, depending on that individual condition, you can choose the correct or the most apt nursing diagnosis. The second one would be activity intolerance related to fatigue. I hope you have come across anyone with this disease condition. If not, make sure, even if they are not included in your nursing care plan, you have a conversation with them, take some detailed history, and you can very well note that they would usually prefer to sit up, or they would usually prefer to be up in the bed most of the time, and they excessively use their accessory muscles, especially the muscles around the neck and around the clavicles, and sometimes you can see their chest protruding, sometimes you can even see them underweight. So these are the couple of nursing problems you might come across in the patients. That is activity intolerance related to fatigue, impaired activity of daily living. I would say in my personal or professional career, I have come across patients refusing to use the commode or refusing to take a bath or going to the toilet because they can become short of breath, and that really impairs them from maintaining the hygiene or having or impairing the activity of daily living. So you can consider these nursing diagnoses. And the third one would be imbalanced hydration or nutrition. This is again, as I've told in the beginning of the video, it's up to you to select which is more apt for your patient. So sometimes they could be brought to the hospital in a very worse situation where they do not, comply with the nutrition or hydration because they feel it could cause shortness of breath or it could exacerbate the disease. So in that case, you could also bring this up as a secondary problem. The primary one being the imbalanced airway, the secondary to be the hydration and nutrition, and ensuring that your patient has enough food and fluids. And if they are not able to, you go ahead and discuss this with the team and making a beautiful care plan for your patient. So these are some of the nursing care plans and the discussions related to it. Let's move to the next slide that shows sleep deprivation related to the disease condition. And your patient may also have deprived sleep, fearing they could have the asthmatic attack when they are sleeping. So this could be the nursing problems. The next slide shows a couple of other nursing diagnoses. It could be actual problem. It could also be a potential problem, isn't it? It could be a risk of ineffective coping in the future. So let's take one by one at the moment. So the first one describes anxiety related to disease condition. They could have fear and anxiety related to the disease condition. They could also have knowledge deficit related to the management of disease. As an example, you have a patient who is brought to the hospital, and upon assessment, you find out that they live in a molded house, or they have a low socioeconomic status, or say they really have allergy to pollens, but your patient is not aware of it. And if they are not aware of it, and you as a nurse who do not if you do not help the patient, they could have they could have back-to-back hospitalization, or they could have future hospitalization. I'm not saying you're the only responsible person, but I'm trying to bring out the idea that you as a healthcare professional, and you among the team members, can address this issue by taking this as a nursing problem and ensuring that your patient has enough knowledge about the disease management. And if you ever think that you're not competent enough, you can always refer them to the other team members that include the specialist nurses or the doctors or even physiotherapists. All right, so that being said, let's move on to the next nursing diagnosis, which is ineffective coping related to the situational crisis. Here, the situational crisis is asthmatic attack. You could have experienced in your personal or professional life. Encounter people who have this condition, and they do not participate in certain activities, and they could be withdrawn. It's not necessary that they are always introverts, but I'm just trying to discuss the situation with you. So say if your patient is a student, all right, it's a he or she is a school going student, and it's a winter season, and they are taking a critical examinations, and they know that for sure they are going to have the asthmatic attack because it's unavoidable. They get it all the time, all the year, and they have that difficulty to cope with this situational crisis, because they think they wouldn't be making it this time, and it's so important for them. And same with the professionals, like whether irrespective of what economic or financial background they have, inability to present themselves to the work might cause a lot of coping problems or challenges in them. So this is, even though I've put these at the end of the slide, it's as important as the other nursing problems one can encounter in asthma. So that being said, ineffective coping pattern or ineffective coping related to vulnerability to the situational crisis. So this would be another nursing diagnosis. So with that, I believe we have discussed all the major or the primary or the common nursing problem one can come across in disease condition called asthma. And the slide, you can see a couple of detailed nursing care plans we have in our channel. Make sure that you do not bind watch, but of course you get time. Spend 10 to 20 minutes watching each video each day and develop a pattern of learning, and you become a confident nurse. So these are the detailed nursing care plans for you if you would wish to have a look. Thank you so much for watching this video. I hope it was helpful for you. If you found it helpful, make sure that you like, subscribe to the channel, and you're sharing it among your colleagues so that they also can become a confident nurse like you. Thank you so much for watching, and see you in the next video.